I went to Nepal to volunteer. I felt like because I had an EMT background, I had some medical skills that I could take abroad and hopefully be effective over there. So I planned to go work in a little village for about 2 months. And then a week before I left, they had their first big earthquake. And so I changed my plans around. I applied to all of these relief organizations, and none of them would take me. They were all basically exclusively for doctors and nurses. And so I ended up just flying over to Kathmandu, staying with a family friend whose house was thankfully fine. And then I met a group of surgeons from Chicago, and they were touring around different hospitals, and I basically just asked if I could go with them for a day. And I went with them to a place called Nepal Orthopedic Hospital, which is basically the orthopedic hospital in Nepal. And I did rounds with the nurses, and I helped out in the medical tent, the emergency room, and I just helped out, and I asked the director if I could stay there for another month, and he said absolutely. So then I worked in the emergency medical tent. So that was dealing with all of the incoming patients from all the subsequent quakes. It was just a tent outside of the hospital. So I did that for a month. They had already dealt with the majority of all of the gross trauma patients. There were a lot of patients that were hiking in, like with a broken arm or something like that, that would hike in for like over a week, or were just waited to get helicopter evac'd to Kathmandu. So we were dealing with a lot of the really old injuries that were still trickling in from the first earthquake, and we were also dealing with all of the fresh earthquakes. It wasn't so much traumatic injuries, but it wasn't from buildings falling over, because all of the buildings had already fallen over. But during the aftershocks, people would freak out because they thought it was another earthquake, and there were so many symptoms of PTSD in all of the patients. And so people would freak out over a little aftershock and jump off their second-story balcony. So we were getting a lot of after the second big earthquake. So the first earthquake was 7.8, I believe, and I was there for the second earthquake. I was there for the 7.6 earthquake. And so 15 minutes after it happened, the hospital was completely evacuated. People just got up and ran out of the hospital. And then 15 minutes later, not even 15 minutes later, all these people, this stream of people were coming in, but all of their injuries were, so what happened to you? And they would say, oh, I got really scared and I jumped, or I got really scared when I was running and I tripped and fell and broke my hand, or just they freaked out because they had just been through this incredibly traumatic experience. And you're here to help, and you're here to do everything you can. So I think that's a very adverse situation, and I think that by throwing yourself into something like that, you learn a lot about yourself, you build a lot of character, and it changes your life. It changes you, and you have an opportunity to change somebody else's life. And I had that a lot. I had people tell me that, like thank you so much, because this hospital changed my life. I've been hiking out of the woods for a week, and now I'm finally here. Thank you so much. Things like that, which are things that you don't get in everyday life here. And it was an amazing experience. So I would encourage anybody out there who's looking at maybe potentially studying abroad or going somewhere else. I thought it was probably one of the best experiences of my life so far.